Hello, I'm from MedStar Health Home Care. In this short video, we want to give you an idea of what it's like to live a day in the life of a home health care associate. We have nurses, physical therapists, occupational therapists, speech and language pathologists, medical social workers, and home health aides who all work together to take care of patients in their homes. Home health is an incredibly rewarding career with lots of opportunities, but it also has some unique challenges, and it's important you understand them. We aim to help you decide if home health care is the right career for you. So I invited some of my colleagues to tell you more about it in this video.
I love home care because it's very flexible. When I was a hospital nurse, it was definitely sometimes a 12.5 to 13-hour day, and those days are definitely behind me, which is really nice. We can start our day after I get my son on the bus. I'll see 5 to 6 patients in a day. Normally I get off around 2. I say off because I'll go home, pick up my kids, but really my work day isn't quite done yet. Sometimes I have to call doctors, sometimes I have to call the patients for the next day, and then definitely I have to finish my paperwork. But I can kind of do that on my own time and my kids' schedule, which is very nice. It offers a lot of flexibility, but I'm still working an 8-hour day. I find home care to be very rewarding, to meet patients where they're at, and I really feel like I'm making a difference.
Home care offers the opportunity for autonomy and freedom. With those great options, there's a lot of responsibility. The responsibility to be the person who's checking on your patient, providing the best medical care to them in their home, making sure that they're safe and that they get the appropriate resources and referrals that they need to continue to have good and improved health. For example, I once arrived at a home where a patient was already on the floor when I arrived. She was conscious, but she was responding very slowly and her breathing was heavy. I had the opportunity to help take care of her, ask someone to call 911, check her vital signs, and make sure that she remained alert until 911 came. Once 911 came, they decided that she needed to go to the hospital. And once she was safely in the ambulance and being transported, I was able to call her doctor to update them on the patient's status. One of the reasons that home care is wonderful is because you get to work in a partnership with the doctors and with the patients to give the patient the best care possible. You get to assess the patient, provide patient and caregiver education. That way the patient can become more independent and safe in their home, and they can return to their prior level of function or to a better level of function than when you first met them.
One of the great benefits of working for home care is your independence. For some people, this may cause anxiety knowing that your coworkers aren't right outside the door. But you're never alone. Even though you're working independently, your friends and coworkers are just a call or a text away. There was a time I had a patient who had a Pleurex catheter. Even though I was trained in catheters, it's been a long time since I've seen a Pleurex. I was able to use my resources to look up videos on how to perform this procedure, and I performed it flawlessly without any complications. When I first started as a home care clinician, I was understandably nervous, but after our orientation process, I've built the skills that I need to become a confident clinician. It takes an independent person to work in home care, and that's something that really appealed to me.
In home care, you don't report to a hospital, clinic, or doctor's office. Your car becomes your mobile office. I have my MedStar home care bag that I take into all my patients' homes. Inside of here are all of my vital signs equipment, any PPE I may need like gloves, hand sanitizer, and barriers to put down. I also have my lab bag that I use for any blood draws that I may need to do on IV patients or regular patients. My sharps container if I need to do any venipunctures or any injections. I have extra PPE, extra sharps containers, meta planners, and our starter care folders that we provide to all of our patients, extra masks. And then I also have some extra wound care supplies, urostomy supplies, urological supplies, anything that I might need to plan ahead for our patients. So essentially, I can reorder all of my supplies directly from my mobile device. Everything gets delivered to my house, and I can resupply my trunk.
My first patient today is a wound patient. I read the referrals from the doctor last night. I will go in and assess the patient, and then speak with the family and the physician to decide a plan of care. I'll decide how frequently the patient's being seen, what supplies they need. We are often the eyes and ears for the physicians and can give recommendations for what the wound care should be. We teach the patient how to manage their medicines, and perhaps if the patient needs med changes, we can make those with the physician. Depending on how the patient's wound progresses, we may need to add some visits. We may need to extend the frequency. If the patient is having concerns at home with safety or weakness, things that would cause the wound not to heal as quickly, we may need to order physical therapy, occupational therapy. I would coordinate with the family and the physician to get these orders. One of the things I like about case management is that we can get the things the patient needs. We're able to see what the patient is missing in the home to keep them in the home instead of back in the hospital. I had a heart failure patient that I had the opportunity to watch go through all of the phases of heart failure. He started out on a milrinone drip where I took care of his IV and taught him signs and symptoms of infection and how to manage his disease. He then went on to get an LVAD, and I took care of his LVAD dressing and helped coordinate with the LVAD team. And then as his disease process progressed, I actually got to see him get a heart transplant and progress and watch his wound heal. And I had the opportunity to see him walking down the street, just happened to see him a few months later as if nothing happened. He was in perfect health. And it was wonderful to be able to see that spectrum of care, see him start out so sick and see that my care helped impact him and gave him back his quality of life.
You know, one of the things I love about home health is being able to build those personal relationships with my patients and their families, building their home exercise program and trying to figure out what the patient and the family wants to work on is something that is very satisfying and is something that you know, you get to do in home health compared to a lot of other places or other settings in physical therapy. You get to see the whole family and get to speak to all of them and really get an idea of some of the things that they all want to accomplish, so that you kind of reduce the burden of care from a lot of the family members. And in home care, you can take your time and really build that relationship, you know, genuinely, and just be able to be there with them and help them as much as possible. So I have one particular patient that I'm still seeing currently where, you know, when we first started, this individual wasn't able to sit up or bring her legs out of the bed at all. She was a patient in her 80s that had a spinal surgery where everything was max assist to getting her to the edge of the bed. And now she's able to sit up at the edge of the bed. We're currently working on sliding board transfers, and that's something that was built and developed through months of physical therapy. There's been, you know, times where the family, the patient, and myself were all cheering about progress that we have been able to see, and it's very rewarding. So it's something that I really cherish and love about home care.
We hope that this honest explanation of home health care has helped you decide whether or not this is the right career path for you. Thanks for watching. We wish you all the best.